You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody in San Diego should be wearing dentures. With us, we have an expert on the topic of dental implants. We've had him on the program before. He's my dentist, Dr. Christopher Henninger. Dr. Henninger, welcome to the program.
Thank you, Randy.
Now, you're my dentist, but you don't have to do a whole lot of work with me. I guess just cleaning my teeth.
You've got great teeth,
But
Randy.
thank you very much. So you brought a lot of photos today.
I did.
And for people that don't know your practice when it comes to dental implants, who's coming in for dental implants?
We have a wide variety of people who come in for dental implants. We can do a lot of things with dental implants, from anything from replacing a single tooth or replacing all of your teeth, or even if you have loose-fitting dentures, stabilizing those dentures with dental implants. Those are the broad categories of what we can do with dental implants. Another group of people that we help with dental implants are people who have sort of given up on going to the dentist. They sort of fought the battle with root canals and gum disease and fillings and crowns, and for whatever reason they've given up. And they've come to a point in their life where they've figured out maybe that there's nothing out there for them as far as what the dentist can offer them. So those are the patients that I'm really passionate about helping, is patients who don't typically go to the dentist. They've sort of given up on their teeth or their mouths for one reason or another. And dental implants can really help us transform somebody's mouth who has sort of given up or lost hope on going to the dentist.
Now, people need to know that, I guess, how dental implants are typically done, and at probably 90% of the places here in San Diego, you go to one doctor, like the surgeon that does the implant. Mm-hmm. Then you go to another doctor that puts the tooth on top, right? Is that true? And then maybe somewhere else for the imaging. You have this where you do it all right there.
Right, Randy. That is the conventional way that dental implants are sort of delivered to the public, is, through a variety of providers. You start off with a three-dimensional X-ray, and sometimes you have to go to a special center to get that done. And then there's usually a surgical dentist who places the dental implants, and then a restorative dentist who will restore the dental implants.
Which means put teeth on top?
Yeah, but okay. Putting the teeth on top. Our office is a little bit unique in the fact that we do everything right in one location. We have a 3D CT scanner in our office, which is really unique. And the same dentist who places the implant also does the restoration on top of that implant. Yeah, that's me. So I've been trained both in the surgical aspect of placing dental implants and also the restorative aspect of making the smile. And that's what I really like about the way we do it is I don't have to send you to somebody else to get help. We've sort of covered everything in under one roof. And I think that's important because we'll be able to develop that relationship with you personally, and you'll be able to rely on us for, getting the job done that you need.
Now, we've talked, really that you see transformations or people's lives change because of this.
Yeah, Randy, dentistry is kind of interesting. Most people don't really appreciate what we do on a daily basis: fillings, crowns, cleaning, that sort of stuff. People, they do it because they know they have to for their health.
Yeah, nobody likes a dentist.
Exactly.
Right.
Dental implants. The reason I got into dental implants is not, from a technical aspect of doing the procedures is interesting to me, but seeing the transformation before and after, and that's why I'm really passionate about people who don't go to the dentist, because there's some loss of hope there, and being able to see people on the other side of that loss of hope is really what keeps me going as a dentist, and it's really the dentistry that I like to do, because people really can appreciate the difference after we get done. Seeing people look at their new smile for the first time after we deliver it to them is my favorite moment in dentistry. And I really get to see, the way people really want to smile come back out. So dental implants, what I really like about them is that it can be a life-changing process that some of these people go through, and people really enjoy to eat and go out to eat, and it's a very social activity, eating, and a lot of people that have stopped going to the dentist for lack of hope have sort of stop doing some of those social things that really are important in life. And seeing somebody go from not being able to do those things that they love, like going out to eat with their spouse, or going to their favorite restaurant, or eat the foods that they really enjoy eating, being able to get them back to where they were before is really what I like about what we do with dental implants. It's not the putting in the implants or the restoring the implants. It's really seeing that personality flip after we get done back to their old self again. These people have sort of
just because of their teeth.
People are getting back into dating, later in life nowadays, and taking somebody with a loose-fitting denture or really bad teeth where they're not comfortable going out in public, and bringing them back to a smile that they can not only eat the things that they want to eat with, like steak and popcorn and nuts and things like that, but getting them back out into situations to where they can date again is really important.
Yeah, good point.
And taking pictures and putting them on Facebook. It's like the new.
So they're taking selfies now that they have their new teeth.
Absolutely.
So you're never too far gone. I mean, people with like the bleeding gums crowd, or the people with really bad gums, they're still candidates, you're saying?
Absolutely. I mean, we have taken people that have, what I call severe gum disease, and there's really not much that you can do for their teeth. And, by taking out the teeth, you cure the gum disease, and putting in the dental implants and the new teeth, you've really restored them back to a smile that they're confident about and really can use that, in their daily lives. And, people change the way they smile when they don't like their teeth. They kind of smile with their lips, or, not that big, broad smile that exudes confidence.
Do you notice it?
I see it all the time.
Like you see people hiding their smile?
Absolutely. Sometimes they'll do it with their hand, or sometimes, ask people to smile for the selfie or whatever, and they smile, but you don't see any teeth. It's just kind of like the, the half smile, I call it. Seeing some of these people afterwards and bring that big, broad, bright smile back to their face.
Especially the people that have never had a good smile in like 20 years.
Absolutely.
Right? They've been wearing a denture.
They forgot how to smile.
Is that right?
Yeah, you sort of, some of the first pictures that we take with them, they sort of do their old smile, and we have to tell them, like, no, you can really smile again. You can, unleash, what you really want to do. So.
Knowing you were coming on the show today, I was talking to my father. My father's one of your patients, and I should mention this. And also, this is a real interview. I'm trying not to endorse you on this show. I'm just asking you the questions. But you've helped a couple of people in my family that are pretty close to me. But my father, he goes, you got to bring this up on your show. So I'm going to tell you. So he was wearing a denture, right? For I think 25 years or 20 years. He's a musician. And he goes, my denture's fine, Randy, my denture's fine. Well, I forced him to watch my interview with you. He goes, I'll talk to the guy. Well, anyway, he goes from a loose-fitting denture, where now his teeth now that are locked in his mouth, he smiles, and he says he feels self-conscious when somebody will go, you have such nice teeth for your age. That's what they tell my father. And he goes, at the beginning I was uncomfortable. He goes, but now it's like, thank you, right?
Yeah.
But he could eat whatever he wants. He could play his trumpet, and you've helped him out. And my son, of course.
Yeah.
You helped him with a cosmetic makeover and some implants. So,
your dad's a really interesting case. I'm glad you brought him up. What really makes your dad tick is playing the trumpet.
Yeah.
When he comes to see me at the dental office, he brings his trumpet. And because that's what he really cares about. He knows he's got a lesson later on that day.
Yeah.
And he wants to make sure he can hit his high notes with the teeth that we're going to put in. So that's how we judge for him what's going to be good, is whether he can play his trumpet. And just the other day he was in the office and he forgot his trumpet. And I said, I really like these. I think they're good. I was like, go get your trumpet. Let's give it a try. He's like, I forgot my trumpet.
He told me about that. He said, the one time I forget my trumpet, he asked me to bring it in.
And he lives probably 30 or 40 miles from our office, it's a trek to see us. And he's like, I'm going to run home and get it. I'm like, Joe, you live kind of far away. He's like, no, I'm going to do it. I have to. And I was like, just come back next week. We'll do it again.
But is that what you find with, like, every patient has their story? My dad's was he wanted to play the trumpet, and he still wants a date. I mean, so everybody has like that tipping point of what they hate about their current situation and what's going to happen when.
Yeah, another patient comes to my mind. Her name is Susan, and she had this really bad set of dentures, and it was hard for me to believe she was actually wearing those in public, but she got to the point where she didn't go out much, and it didn't really matter to her, and this and that. But her daughter was getting married, and that's sort of what her tipping point was. It's really interesting when you can get to somebody's like motivating factor, and her motivating factor was her daughter told her she had to get new teeth because she was going to be in the wedding.
Wow.
And so she came in, and we figured out what was right for her and did her smile. And gosh, she went from this lady who never smiled. I mean, she was one of those like pucker smilers, and she's got the biggest white.
And she was wearing a denture,
smile.
and you gave her teeth back with dental implants.
Absolutely. So we did a combination of things for her. Very interestingly enough, we did a full set of permanent teeth on the bottom, and then on top, we did a brand new denture that's anchored in.
Okay.
So it's not the loose fitting dentures that are held in by suction. This one is actually fixed in her mouth. So. And what really also very interesting about Susan, she got to go to the wedding, and that went off really well. But then she got into kayaking, and all she can talk about now is kayaking when she comes in. But I don't think she would have ever done that before because she was too afraid to go out.
Now in your office, we hear things that in one day. So it is all done in one day. I mean, the day of the procedure, they could walk in with no teeth and walk out with teeth that don't come in and out.
Exactly.
Is that true?
Yes, absolutely. The teeth in a day process, or the fixed teeth that we do, the transformation happens in one day. And it's really awesome to be able to take out somebody's bad teeth, put dental implants in, and put a new set of teeth in the same day, and wake them up from the surgery and see the look on their face for the first time. You asked me, what I like about dentistry. That moment is what I really like about dentistry, is seeing the expression.
In the mirror, they look at their...
Yeah, seeing the expression on somebody's face for the first time when you've made that dramatic change for them. It's just, you create a bond with your patients that's unlike no other.
You were telling me something in the green room I think people need to know. So you were like chuckling to yourself as you were looking at your own photos.
Yeah.
And you say, I laugh because it makes me think of these people, right? Because you get to see, I guess, them from being miserable to now having teeth and they're happy.
Yeah,
Is that the chuckling part? I mean, where you see that what this has done for them?
I don't look at these pictures every day, but when we get ready to do a show, we want to bring out our best cases, and some of these cases I haven't looked at in a year or so, and you look at their smiles, and you're not necessarily looking at their teeth, but you look at their face and their smile, and you just like have to laugh to yourself because you remember what they were like before.
Nice.
And everybody's got a unique story, like Susan, who likes to kayak now. I mean, she's like your dad in the trumpet. All she talks about is kayaking. And
now you brought photos. We have time for some of those. Let's take a look.
I do. So the first gentleman that I'd like to start off with, he's really interesting. He came, actually he saw one of our shows from the Wellness Hour, and he came to see me, and he had been looking around at doing a smile for quite some time. But he had been told by a number of dentists that, he has this big bridge across the front that's failing.
So that's what I'm looking at the top. That's a big set of bridge.
Yeah, it's a
cemented in there.
A tooth-supported bridge.
Okay.
Yeah, so he still has some natural teeth, but he has a big bridge across the front, and then he's got severe gum disease on the bottom. And some dentists along the way told him there's nothing that can be done for him anymore, and that he needs to get dentures.
Okay.
And this guy was not willing to accept that. I mean, this guy's
no dentures for this guy.
Yeah, absolutely not. And so he just quit going to the dentist because he didn't like the answer. But then when he saw us on TV and came to the realization that there was something else out there, he was motivated to come see what.
Are they skeptical? Like they come in, they go, "Is this? I could really do this kind of a thing?"
Absolutely. And he didn't really believe that it could be done in one day. And he spends a lot of time in public. He comes into to San Diego County for the Del Mar races, and then he goes back to Las Vegas. And so he spends a lot of time with people, and he didn't see that he could go without teeth. And so he wanted fixed teeth that don't come in and out. He was unwilling to wear a denture. And so we were able to remove this guy's old bad dental work and his remaining teeth, put in dental implants.
Very nice.
When he woke up and saw his smile, he's like, "This is what I've been waiting for." That's what his words were. He's like, "I've seen commercials on TV, and I saw your show, and this is what I've been waiting for." You could tell he was just sick of his old teeth and sick of his old smile, and he wanted to let his personality out again. And you can see in the picture, like it's like his eyes are open up wider than they were before. And he almost kind of looked like a sleepy guy, but he was just. He didn't like using facial expressions because
so you see them one way on the consult. They're nervous, they're miserable, right? They're in pain sometimes. Yeah. And then once it's all done, it's like they're not even the same people.
Absolutely.
Some of them. Or most of them?
Yeah. Everybody who comes.
Like you're surprised you didn't even know that they had this personality?
Absolutely. So people come in, they're very skeptical. you know, and rightly so. You know, it sounds like it's something that just can't be done. But you know, some people don't even really look you in the eye when they're talking to you. They look down or look the other way, and you know, they're just not confident.
Well, it's like embarrassing, right?
Yeah.
Showing your mouth to a dentist, especially when it's broken down.
Certainly. I get that all the time. My patients will tell me, "So, Doc, I'm sorry, I didn't brush," or "Doc, you haven't seen anything like this." And I'm like, I've been doing this for a long time. There is nothing in there that I haven't seen before. And that's the truth. But it sort of helps people, you know, become a little bit more easy.
Now, for people just tuning in, you're watching The Wellness Hour. I'm Randy Alvarez. We're talking about replacing missing teeth with dental implants. We're with San Diego's implant dentist, one of the busiest guys in Southern California, Dr. Chris Henninger. So, do you get recognized, by the way? Because you're on TV a lot. Do you ever get recognized? Like, are you that doctor?
I do. Some of my friends will see me on TV and like, I saw you on TV the other day. And then when people come in to see us for their consultation, they're like, well, you look better in person than you did on TV. I guess they say.
Do they ever ask about me, by the way?
No.
Never ask about me. Okay, good. Okay, I'll let you go back to your photos.
Yeah, so this is Susan. Again, what I consider a life-changing smile. She's my kayaker friend. She just had a very poor denture and it wasn't fitting well.
That was a denture?
Yeah, she obviously couldn't eat with it. And
so like broken off teeth on the denture and people still keep their dentures?
Yeah, she had.
That's got to be uncommon.
She was a little bit of an unusual case because, you know, but she had even given up on dentures. Like she didn't want to go get a new set of dentures because she just didn't feel like it was worth it. But once she saw what we could do with dental implants and there was a possibility that she could get real teeth and not denture teeth again. I mean, that's what sort of motivated her. And I mean, look at her smile. Like you would have never guessed that.
So they could eat whatever they want?
Yeah.
I've asked you this before and I'm still skeptical, but they could like bite into hard things?
Yeah, these are as close.
Like nuts?
Absolutely. So people who have dentures are very conscious about biting things off with their front teeth because it's just the physics things. If you put too much pressure in the front, the back's going to come out and that sort of thing. You know, this dental implant supported bridge it's fixed in your mouth and you can bite off apples, eat the steak that you want. Really, you can choose anything you want off the menu that you would go to.
Do they ever call you and say, "Are you sure I could eat this?"
All the time. They're like,
they do?
I don't want to break it. These teeth look so good. You know, are you sure I can eat it? And yeah, of course. I get those questions all the time. Even after we're done, they're like, "I know you said you could eat whatever you want with these teeth, but really, what can I eat?" And I'm like, "No, go for it. You know, take it easy the first couple of days, but you know, once you get used to them, you should be able to eat whatever you really want to eat." So
okay, good.
I've had people tell me like they come in for their final checkup visit and they're like, "I'm going to my favorite restaurant right after this. Is it okay?" Like, yes, go for it. You should have already done it by now. So,
okay, good.
But yeah, the next case we have, her name's Lauren, and I went to school with her sister when I was in college. And you know, Lauren, when we first started her, she was in her mid-20s, and through some unfortunate circumstances, she was told that she needed dentures at 25. Can you imagine?
So those teeth I'm looking at all had to go?
Yeah, so that's what her dentist was recommending, that she had her teeth pulled and have dentures. And I said, "Lauren, come on, you know, you're like family to me. Let me take a look and see what I can do for you." We did have to remove all of her lower teeth, but we gave her a fixed set of teeth on the bottom, and we just did
like a full arch of teeth.
Full arch of teeth. And then on the top, we actually found a way to save all of her upper teeth, and she just had some veneers and some crowns done on the top, and she really got her life back. And she has kids the same age as my kids, and I take my kids to the park all the time. You know, try to get them out and see the world, kind of thing. And her kids. Lauren herself was suffering, but also her kids were suffering because she had bad teeth. And
what does that mean? What do you mean?
She wasn't able to take her kids to the park.
Oh, she was that self-conscious?
Absolutely. I mean, you see moms walking all over the place with their kids in the stroller and that sort of thing. She was not able to do that for her kids. You know, take them to the birthday parties and take them to the park and just socialize with other mothers.
So now she's back.
And once we did her smile, you know, she's back to, you know, your prototypical mom, which is what she wants to be. And so there is this misconception that these procedures are for older people and for people who have just neglected themselves for years and years and years. But Lauren is a good example of somebody who we changed her life at a very young age.
Good. Hey, you know, we were talking in the green room earlier, and you say people with bad teeth, they're discriminated against. Elaborate on that.
You know, you feel like people who have bad teeth, they're not given the chance that they deserve. They may have a really high skill level in a particular field, but if you go on an interview and you're missing a front tooth, or somebody will discriminate you against, and say you're
poor,
not worthy of the job,
okay.
or poor, or this and that, but and behind this bad smile is a really intelligent individual that may have, some super sharp skills, but their teeth are what is holding them back from getting back in the workplace again.
Okay.
So yeah, you absolutely see people who have had to stop their normal life because of their teeth. That's a story that I hear all the time. Like, doc, I got to go out and get a job.
Is that right?
But I can't do it. I really can't because of my smile. And so we have a lot of people who are trying to get back into the workforce.
They get their teeth back, their confidence is back.
Absolutely.
Their mojo.
Absolutely.
And they're applying for jobs.
And
That's good. That's good.
I can see in some of these people that deep down inside they have the confidence to be a productive member of society. It's just they don't feel comfortable going out with the way that their smile is. So here's another patient. This guy's name is David, and he's sort of a combination of issues with his teeth. He got to the point, just like some of our other patients, that just refused to go have the painful dentistry, the expensive dentistry that he had been having throughout his life. He was just sick and tired of the whole dentist thing. And the other thing was with him was he actually got cancer. And he went through some hard times with his health, and that really took a toll on his teeth too. This guy, big guy, he's like 6'5" and not of modest stature at all. And when we were able to remove his bad teeth, and he did also the fixed teeth. Okay.
So he would have had a denture.
Absolutely. He was told by another dentist that the only thing that could be done for him was a denture. And when we met him, we said, David, that's not the case. It really isn't.
So now he has upper and lower teeth that don't come in and out?
Yes, he has upper and lower fixed teeth that don't come in and out. And this is another good after story. When we put his teeth in, you got this big guy. He almost looks like a football player, and he starts to cry. And you can't help but share that emotion with him. I kind of get choked up talking about it. But and he gives you this big hug in the middle of the office, and he's crying. And
That's great.
We're a normal dental office, and we have other patients in the practice just getting their teeth cleaned, and everybody's like, "What's wrong with that guy?" And it's really thought provoking, and it provokes a lot of questions with other people. Like, why is that guy so emotional at the dentist?
Yeah.
And honestly, that really changed this guy's life.
And you see that every week,
Yeah,
like almost
absolutely.
every day, something like this is going on. Yeah. And we are short on time. But we should mention insurance, because we get emails too. And I always say, look, we're just interviewing the doctor, but my understanding, insurance doesn't cover the entire procedure of dental implants here in the US. PPO, HMO, doesn't matter, doesn't cover the whole thing. Also, like Medicare, Medicaid, doesn't cover it at all here in the US. But you have financing that you work with these people.
Absolutely. Most every case that we've showed you today were people of modest means. And we had to find a way to help them make this happen. And, we have several third-party financing companies that we use that allow you, just like when you buy a car, to break it up over time. So you just have the monthly payment, but you're able to, get the smile that you need. And, we can also put you on sort of like a savings plan is what I call it. You start saving up, and once you have enough, credit built up, we'll do the surgery.
So you could stage the procedures.
Absolutely. So,
and we should mention sedation. We literally are short on time, like a minute and a half left, but because of your military training, you have your IV sedation trained.
Yes, absolutely.
So most of these people had IV sedation. They felt nothing. My dad, by the way, went to you, and he says, Randy, I felt nothing.
Right.
He goes, I was so afraid the night before.
Yeah, absolutely.
I'm on video saying that.
Yeah, we did a lot for your dad too, and for him to see his reaction the next day was really, really impressive.
So sedation, everybody gets it pretty much?
Yeah, it comes along with what we do. Okay. I don't do these procedures without sedation, and the one thing that really holds people back from getting their teeth done is the pain and the cost, but the fear of going through these type of procedures. Maybe this exists. Maybe this is possible for you, but the fear is really what keeps you from coming. I encourage you to come meet us. We're down to earth people. We really enjoy hearing stories, as you know. But the sedation, what it does for you is it takes away the fear factor. So I certainly know that fear comes along with dentistry,
Yeah.
and that's why I do IV sedation. I went to special training to get IV sedation trained. I'm one of only 5 dentists in the county, restorative dentists in the county that can do IV sedation. And I was really passionate about having that skill to offer to my patients because I know that sometimes alone is the one barrier that keeps people from coming. And if you're looking at this show today and struggling with fear, I want you to know that the sedation part of what we do eliminates that. Yes.
Is it true you even maybe give them a pill the night before?
Yeah, so we can start off with some medication before, the night before to help you sleep the night before, and then you always have to have somebody drive you to your appointment. But we'll start an IV in your hand or your arm, give you medication through the IV. And the nice thing about sedation is while you're undergoing the procedure, you won't be aware of anything that's going on. And most people remember very little, if anything, after the procedure.
So no more dentures. You think you could wipe it out in San Diego? Are there really even a lot of people here in San Diego, we're a healthy city, that have dentures?
Even in a city such as San Diego, where people are really health conscious, there's tens and tens of thousands of people that
Like an upper or lower denture?
that are struggling with dentures or struggling with the thought that they may have to get dentures
Because their teeth are so bad.
because their teeth are so bad.
So no matter how bad your teeth are, no matter how bad your gums are, you could do this.
Absolutely. There's very few people that we have had to turn away and say, you're not a candidate. Whether you're 85 years old or 25 years old, again, very few patients with the technology that we have available to us today that we have to say no to.
What's your oldest patient that's had this done?
The one that is on the top of my head, she was 85 years old, and she was like one of the people we talked about. She had a bridge that she lost, and she refused a denture. She said, I am not doing a denture. I've made it this far without a denture. I am not going to live the rest of my life with a denture. And so we did the fixed set of teeth for her, just on the top, and she
loves it.
She absolutely loves it. And I tell people, I don't know how long you're going to have, I don't have a crystal ball and this sort of thing. But what I do know, if I can make whatever years you do have left enjoyable, I've done my job. And
Good. We should mention my son, he was born without teeth on the upper, like missing most of his top teeth. And you have a photo here of him. You gave him a combination of like cosmetic dentistry and implants.
Right.
And he loves it. He smiles now all the time. He's on Facebook. No, he doesn't do selfies. He's anti-selfie,
Right.
but he does smile a lot.
Yeah, he does. And I knew Corey beforehand, and I knew him afterwards. And again, he, through no fault of his own, was missing teeth. I mean, this wasn't because of neglect or just fear of the dentist or anything like that. He was actually born without these teeth. And seeing his personality change was
after it was all done, he goes, Dr. Henninger was right. He goes, I'm going to go hiking, running, skydiving, swimming, like they do on the commercials, like Hair Club for Men.
Yeah.
He goes, my whole life has changed now, right?
I don't know about jumping out of planes, but okay.
Right, but you could, well, good. Look, always a pleasure to have you on the show.
Thank you.
Final message, though. Somebody watching this, they're either headed to a denture, right? Or they've been told they needed a denture, or they're already wearing a denture. But for whatever reason, they don't want to go to the dentist.
Right.
What do you say? They're afraid.
I say we don't charge for consultations. There's really no risk in coming in to find out what's available for you specifically. So, I feel like, these things exist, this technology exists. Come find out what's right for you. We have several different options. We can find something that's right for you.
Good. I want to thank you for coming to the show. Always a pleasure.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.